started. My name is Casey Skarecki. Thank you for joining us. I am the sponsorship sales executive here at the New Jersey Business and Industry Association. And welcome to the connection between oral and mental health. It's brought to you by Delta Dental, Focus New Jersey, Manufacturing Counts, NJBIA HR Support, and the New Jersey Business Magazine. And with us today, we're thrilled, is Karen Hepp of Delta Dental. A little bit about Karen. Karen joined Delta Dental in October in 2016 as a small group marketing director. Today, Karen serves as Delta Dental's Assistant VP of Small Group and Individual Broker Channel Sales. Karen brings with her 20 years of experience as a sales professional with key skill sets, including strategic account and personal management, dynamic communication skills to establish and maintain key client relationships, and leading highly effective teams that deliver outstanding results with expertise and professionalism. A few housekeeping rules before we start today. Not really rules matters. Today's webinar is being recorded and will be emailed to you. So keep a lookout for that. I'd like to draw your attention to the questions tab. We will be taking questions at the end of the presentation, so keep that in mind. And so without further ado, I'm going to send it off to Karen. So Karen, please take us away.
Great. Thanks, Casey. I appreciate that. Good morning, everyone, and welcome to today's session on the connection between oral health and mental health. I'm delighted that you've joined our friends at NJBIA and me, and I trust that our brief time together will be of value to you. So let's get started on what I hope you will find to be an informative webinar on the connection between oral and mental health. Throughout this presentation, we will reference data from Delta Dental's 2024 State of America's Oral Health and Wellness Report and other research. The 2024 report results are based on responses from 1,000 nationally representative U.S. adults ages 18 and older, and 1,000 parents of children ages 12 and under. So when you think of your overall physical health and mental health and how they're linked, what comes to mind? Perhaps the link between depression and not taking care of your physical well-being through regular diet and exercise, or maybe the problems associated with self-medicating with tobacco, alcohol, or legal and illegal drugs to get temporary relief from stress and anxiety. Perhaps you thought about a lack of sleep wreaking havoc on your ability to stay focused, or sleep deprivation destabilizing your mental state. Did oral health show up near the top of your list? If not, then you're not alone. However, as we'll see in today's session, there is absolutely a link between oral and mental health. Continuing with the theme of the oral overall wellness connection, here are some facts you may not be aware of. More than 90% of all systemic diseases are linked to oral health. And the mouth can provide important early warning detection for more than 120 diseases and conditions. For example, a routine oral exam can detect evidence of diabetes before it's even diagnosed. Oral and vision health plays a vital role in your overall preventive care, and research has shown that there is a direct correlation between oral health and overall health. Poor oral health can lead to poor overall health. However, it is also true that poor oral health can be an indication that individuals are at risk or already suffer from other major diseases. Research has associated periodontal disease, an infection in the gums, or the tissues that hold the teeth together, with other medical conditions like heart disease, diabetes, obesity. Research also suggests that the bacteria behind gum disease can travel throughout the body, triggering systemic inflammation. Beyond diabetes and heart disease, a relationship has been established between poor oral health and pneumonia, Alzheimer's disease, and even cancer. In turn, research has found that treatment of periodontal disease can lower inflammation and improve other systemic health conditions. So a healthier mouth has been linked to less hospitalizations and consequently reduced expenditures. As I mentioned, an oral health examination can reveal more than 120 conditions, including osteoporosis, oral cancer, and plus conditions like gum disease have been linked to other chronic health problems such as kidney disease, stroke, and pregnancy complications. So let's take a brief quiz. Don't worry about clicking or typing anything. According to the Oral Health and Wellness Report, what percentage of US adults believe there is a link between their oral health and their overall health? 10%, 50%, 100%? It's just over 9 out of 10 adults surveyed are aware of the connection between their mouth and their body. As we talk about this every day at Delta Dental, it's great to see that we are moving toward a better understanding of how your oral health and your overall health are interconnected. When you break this down, there is good news here, as a growing number of people understand the link between oral health and heart disease, respiratory illness, high blood pressure, and other major conditions. That's some encouraging progress. These percentages have increased over 2023, which again shows improvement in our awareness, which will drive people to take steps to focus more on their oral health care. And as you'll see here, Gen Z and millennials are even more likely to understand the connection between oral health and medical conditions, perhaps because they're more plugged in via social media than their older cohorts. But let's expand upon this connection by taking a closer look at some specific illnesses. It's no secret that the teeth and gums harbor bacteria that live in dental plaque. The American Thoracic Society explains that plaque isn't removed through brushing or flossing. It can be inhaled into the lungs. For healthy lungs, this shouldn't be a problem, but damaged lungs are unable to defend themselves, leading to an increased risk of infections. Gum disease has also been shown to worsen the chronic inflammation associated with asthma and COPD. Oral health also plays a role in heart health. A study published by the American Heart Association found a relationship between cavities and intracerebral hemorrhage, a type of stroke. This study followed over 6,500 people for 30 years and found that those with cavities had 4.5 times higher risk of stroke from a brain bleed than those without. For the most part, cavities are caused by Streptococcus mutans, which contains a collagen-binding protein that inhibits platelet aggregation. Translation: the same bacteria found in dental caries or cavities has been linked to brain bleeds, which cause strokes. Diabetes is another prevalent disease that has been connected to oral health. According to an article published in, I'm going to hopefully get this right, Diabetologia, there's a clear relationship between periodontitis, the most severe form of gum disease, and diabetes. Evidence shows that diabetes increases the risk of periodontitis, where periodontal inflammation negatively affects glycemic control. Given what we've just learned about the connection between oral health and specific health conditions, it's promising to see that our Oral Health and Wellness Survey also found that over 9 in 10 adults, 91%, believe that a dental visit is as important as an annual physical. In fact, we found that some people will visit their dentist before they'll go in for a physical. And this just underscores the valuable role that dentists play in early detection, treatment, and preventive diseases. Here's what Paul O'Kane from Delta Dental of Idaho has to say about the connection. Oral health is not just about a healthy smile. It's intricately linked to our overall well-being. Understanding and prioritizing oral health is about more than teeth. It's about safeguarding against systemic illnesses, fostering better quality of life, and promoting holistic health. When we think of our overall well-being, do we consider the connection between oral health and mental health? Let me ask another question. What is the percentage of adults who believe taking action to protect oral health is closely connected to mental health? What do you think? Half, more, less? 77%. A bit of a drop there compared to the oral overall health connection, right? However, that doesn't mean the link between oral health and self-confidence, an aspect of mental health, isn't recognized, as 92% of those surveyed understand the connection between their oral health and how they feel about themselves. Let's focus on confidence for a minute. For any age group, The pain, embarrassment, and social stigma associated with dental problems can take a major toll on one's mental well-being and self-esteem. When we feel insecure about our smile and our oral health, it can severely undermine our confidence. Think back to your middle school days. How many of you wore braces and opted for a closed lip smile that hid the metal in your mouth? That lack of confidence can directly impact performance at school or in the workplace. We may hesitate to speak up, be reluctant to smile, or be subconsciously closed off during peer interactions or team collaborations. Once again, as with overall health, younger generations get the connection between oral and mental health too. As you see here in this slide, Gen Z and millennials seem to be more in tune with this fact. Maybe TikTok isn't so bad after all. Of course it is. So how does poor oral health impact mental health? As you probably expected, it leaves a mark, as about 1 in 5 adults can experience anxiety, sleeplessness, or embarrassment about how they look, and 1 in 7 may feel sad. Again, this is even more pronounced among the younger generations. Think about their perfect peers with their perfect smiles, clothes, food, figures, and lives all displayed on social media, as they are even more likely to skip social engagements due to dental issues. So let's pause for a second and get practical. Just as the simple act of making one's bed in the morning can get them on the right track of accomplishing the next thing and the next thing, there's something everyone can do every day to get a little win for their overall health. Just brushing and flossing. It's pretty easy. So jumping back to the original Delta Dental survey on America's oral health, these 3 areas, fresh breath, white teeth, and an attractive smile, were identified as the most common reasons why people do this simple act of brushing and flossing. Maintaining your appearance boosts confidence and a sense of well-being. Sometimes it truly is the little thing that can get you on the right path. Of course, the connection with mental health goes beyond simple benefits of appearance. Here's what Cassandra Kolb from Delta Dental of Kentucky has to say on the importance of oral care in maintaining mental health. The relationship between oral health and a person's mental state is profound. Ignoring dental care can not only lead to discomfort, but can also contribute to feelings of embarrassment, isolation, and even bullying. This highlights the urgency of prioritizing comprehensive oral care for one's mental well-being. We see that maintaining good oral health goes beyond caring for your body, but includes your whole self. So how does this work? What does a simple act like brushing your teeth, or why does it have such an impact on your mental well-being? Well, in a word, it's interdependence. So while there isn't 100% consensus on exactly how or to what extent oral and mental health are interdependent, there is a growing body of research across the globe that indicates that there is indeed a link between the two. As a side note, it will be interesting to see how COVID's impact will be documented in future studies, what with the stress and uncertainty surrounding even venturing out of your home for fear of catching the virus. Anyway, for the next few minutes, we will discuss what the link between the two can look like. So what do we mean by interdependent? In the case of oral and mental health, each element has a direct impact on the other. It's a two-way street where A can cause B or B can cause A. Let's start with the basic example. Depression can cause one to lose their motivation to keep their personal hygiene in order. So they may stop brushing or flossing. You can flip this relationship, as poor oral hygiene can cause low self-esteem and depression. Incidentally, one frequently observed companion of depression is smoking, which can lead to tooth staining, tooth loss, gum disease, and in some cases, oral cancer. The link between oral and mental health is hard to ignore. Data from the National Health and Nutrition Examination Survey in the mid-2010s showed that almost 2/3 of people with depression reported having a toothache in the last year. It also indicated that half of all people with depression rated their teeth condition as poor. A scientific review of related studies found a strong link between periodontal, which is gum disease, and mood conditions like stress, distress, anxiety, depression, and loneliness. The most obvious explanation for the link comes from the behavioral effects of stress, depression, and anxiety. People with these conditions sometimes lose focus on oral health habits, which can lead to significant dental issues. Depression, for example, can cause people to brush and floss at irregular intervals, skip dentist visits, have unhealthy diets, and self-medicate with smoking. Or suppose that someone has anxiety or fear of going to the dentist. That can convince them to forego routine checkups. Conversely, missing those routine checkups can result in the patient noticing that something isn't right in their mouth, but they respond by being afraid to go to the dentist to confirm what they suspect. Poor hygiene and a fear of going to the dentist are a 1-2 punch that can lead to cavities, inflammation, and pain, which can in turn lead to social embarrassment and sadness that can fuel a decline in mental health, causing a downward spiral into declining overall health, which can in turn increase the incidence of mental health conditions. Conversely, a positive, proactive mental state will be more conducive to getting their routine dental care that can help prevent cavities, inflammation, and pain. It seems simple, right? To take care of yourself by basic hygiene and routine dental visits. However, for those suffering from poor mental health, it isn't that simple or easy. You can just pick about any one of the items in this word cloud and find a related oral health implication that can be a cause or effect. We've discussed depression and anxiety and their role in exacerbating poor oral hygiene. How about the shame and insecurity caused by a person's perception of the attractiveness of their smile? Or jealousy when they compare themselves to others? Or the sense of disapproval in how they look? Or sadness in their oral health, potential despair due to chronic pain, and the financial stress that may keep them from getting the dental care they need. For those with oral health issues and no clear path through them, the mental toll can be significant. Let's look at some direct correlations between mental and oral health. First one on the list is anxiety. It's a well-known, highly publicized condition. It can be manifested in bruxism or grinding one's teeth. Oftentimes at night, while one is asleep, when left unchecked, grinding teeth can wear down the enamel and make teeth susceptible to fractures or cavities. Counters include finding ways to handle stressors via diet, exercise, and stress, or the use of over-the-counter or dentist-crafted mouth guards. Jaw clenching associated with anxiety can lead to chronic pain as well. Oh, and let's not forget that anxiety can lead to canker sores. And let's add some more to the pile. The stress associated with depression and anxiety can help produce cortisol, everyone's favorite anti-weight loss hormone that can, if chronically elevated, lower the body's immune response and lead to gum inflammation and disease. I'm going to stop before we start feeling even more anxiety about anxiety. Eating disorders, whether manifesting as a poor diet, chewing on non-food items, or bulimia, these can cause tooth decay, worn enamel, and poor gum health. A poor diet can rob teeth and gums of the balanced nutrition they need to stay healthy, and regurgitated stomach acid can damage teeth and gums too. Those suffering from bipolar disorder have a higher incidence of cavities and periodontal or gum disease. Additionally, they may also experience a higher incidence of dry mouth and excessive tooth wear. For people with obsessive compulsive disorder, brushing can become an excessive ritual that again causes worn enamel and raw bleeding gums. According to the American Psychiatric Association, Oral health plays a role in the memory of older adults. They report that periodontal disease and tooth loss reveal a higher risk for dementia, while gum disease and the formation of amyloid plaque are linked to Alzheimer's disease. A counter for the impact of dementia and Alzheimer's is for caregivers to help the patients maintain good oral health and ensure frequent dental examinations. Even if the medications used to treat the above disorders and diseases can have negative side effects on one's oral health. The American Psychiatric Association also says that mood stabilizers, antidepressants, and anti-anxiety medications can hinder saliva production, which plays an important role in food digestion and the killing of bacteria. I've mentioned a few counters here to the handful of conditions that are listed. And a consistent theme here isn't that brushing or night guards or nutrition, etc., will cure the underlying mental disorder. Rather, they will help support the patient's oral and overall health during the acute or chronic mental health crisis, and hopefully result in not compounding an already difficult situation. And as I said earlier, routine brushing and flossing is a powerful ally in overall wellness. The link between oral and mental health is especially pronounced for adults aged 50 and older. A 2023 Delta Dental of California study found that 1 in 3 older adults admit to skipping the dentist and cutting back on brushing and flossing when feeling depressed. Neglecting oral hygiene like this can create a vicious cycle, as 45% of adults report tooth pain negatively affects their mood and mental health. Let's look at some trends in the dental world. We'll start off with some good news from the Delta Dental study. Year over year, you can see the increase in planned preventive visits and the decrease in unplanned reactive dental visits. And that makes perfect sense when you think of the adage, an ounce of prevention is worth a pound of cure. Those 2 per year minimum routine dental checkups really matter, not only for your oral health, but as we've discussed, for supporting mental health. Avoiding pain feels good. The emphasis on preventive care has the positive byproduct of keeping up personal appearance, perhaps reflected in the drop in visits made primarily for personal appearance. A clean, cavity-free mouth is really empowering. Knowing that you just headed off a more serious condition by detecting it before it became serious, that's a win worth celebrating. With a sugar-free dessert or healthy snack, of course. All right, go ahead and have the donut, just as long as you drink a lot of water to get that sugar off your teeth. Finally, let's talk about how we can ensure that people get the dental care they need by removing barriers to access. That can look like companies ensuring that their employees have access to dental care, or, as I'll discuss in a moment, providing extra care for those who need it most. Jumping back into the study, it's good to see another positive trend here. Dental insurance coverage over the last 5 years is increasing overall, with just under 2 in 3 adults surveyed having dental coverage. Why is the level of coverage increasing? Well, one reason could very well be tied to the back to mental health, in that insurance provides a safety net that protects one's financial health and reduces anxiety about how to handle dental emergencies. That's the case for 90 surveyed. And incidentally, 85% of those folks believe that coverage saves them money in the long run, and 84% believe it's worth the cost. Dental benefits also provide crucial coverage that parents recognize as a priority for their children's well-being. A reassuring 88% of parents report having dental coverage for their kids. Early childhood tooth decay, otherwise known as cavities, is the most common childhood disease and often is accompanied by other serious conditions affecting children, their families, the community, and the healthcare system. An article by the University of Illinois of Chicago states that early childhood tooth decay has been related to impaired development, low educational performance, poor behavior, family stress, and diminished quality of life. With preventive dental visits facilitated by dental coverage, stated another way, when people have access to dental benefits, they use them. Fewer children may miss school due to oral health problems. According to our oral health and wellness report, currently 55% of children who experience such issues miss an average of 4 days of class time. And beyond the educational drawbacks caused by this absenteeism, parents may have to take time off of work to care for their children, leading to increased stress levels caused by lost productivity and potential financial strain. This is an interesting slide that's going to make you jump back to a bit earlier. Remember when we talked about how more than 90% of surveyed adults recognize the importance of overall health? Of that same population surveyed, 83% of those with dental insurance coverage actually visited the dentist, and only 58% of those without coverage did. That's a stat that could be stronger, that should be stronger, really. That's where companies like yours come in. There are steps businesses can take, easy to implement, affordable steps they can take as part of their approach to supporting employee wellness. By providing employees with the coverage they need to protect their and their family's smiles, a company is investing in their own business and productivity. At Delta Dental, we believe that everyone deserves a healthy smile, and that a healthy smile can play a role in maintaining the whole person. Delta Dental's networks are national networks which provide access to people wherever they are, traveling, working remotely, snowbirds, and we build and maintain our own networks. We do not lease other networks where we have no provider relationships or control over the credentialing of those providers. And credentialing is important because it protects our members. While other carriers have what we call, and this is an important one, a missing tooth exclusion, where missing teeth are considered pre-existing conditions, we take a different, unique approach. Just because teeth are gone doesn't mean they should be forgotten. Our missing tooth inclusion recognizes the impact missing teeth have on one's self-confidence, nutrition, and mental acuity. That's why we provide coverage for implants and bridges to help fill the gap, no pun intended. Even if you came to us with the missing tooth situation, this ensures everyone has access to restorative dental treatments that not only improve oral health, but also boost self-esteem. We provide dental and vision as well. And I could have talked about the role of eye health on your mental health too. But anyway, we provide affordable dental and vision options for individuals, families, sole proprietors, and companies, small and large. So if you're looking for individual coverage or small business plans, I encourage you to visit realhealthysmiles.com to get an instant, no obligation quote. It's an easy, low anxiety first step in getting the coverage you and your employees need to promote overall wellness. Or if you want, you can snap the QR code on your screen. So this is something that is near and dear to my heart. Earlier, I mentioned how Delta Dental provides coverage for those who need it most. For the 6.5 million Americans with intellectual or developmental disabilities, getting adequate dental care can be challenging due to their particular special healthcare need. That's why when it comes to going to the dentist, our special healthcare needs benefit aims to minimize the stress and anxiety for both the patient and their caregiver. Since January 1st of 2024, Delta Dental makes it easier for patients to get the care they need and for dentists to provide that care. Our special healthcare needs benefit provides additional dental examinations and/or consultations, up to 4 total cleanings in a benefit year, and coverage for anesthesia and nitrous oxide for those that need it to get the care that they need. We are proud to be able to offer this expanded benefit to those who need it most. So let's close with another quick question. What health benefits does a simple, real smile impart on your wellness? Well, it lowers your blood pressure. It reduces stress, promotes a stronger immune system. It improves your mood, releases endorphins that can help reduce pain. And a smile makes you more attractive. And it also tells your brain that everything will be okay. A smile is free and anyone can give one away. So in conclusion, the connection between oral health and mental health is undeniable. As we strive for better health outcomes, let us not forget the importance of oral hygiene and its role in our mental and emotional health, and the ability as we as business leaders have to help our fellow employees protect their smiles, and by extension, their overall physical and mental well-being. I'd like to thank everyone who joined us today, and I hope that you found the information I shared with you informative. Thank you, and enjoy the rest of your day. And I will now open up the floor to any questions.
Karen, thank you so much. So interesting, and speaks to, I mean, just I know that my mom had her, her whole mouth redone, and her just how she interacts with people, and she just has such a spring in her step. It just made all the difference in the world to give her a whole brand new smile.
Yeah,
Um,
that's wonderful.
So I just have a question. And you touched on it about employers. Just curious, what percentage of business owners currently offer dental insurance?
Yeah, so about 90% of employers with 500 or more employees offer dental benefits, but on the other hand, only about 14% of employers with less than 10 employees offer dental coverage. So, I mean, because it's such a priority for employees, they list it as the #2 desired benefit. It is becoming more of a priority for employers to offer. But it's really a way for employers to maintain that competitive edge by offering that benefit with retaining and attracting employees.
So absolutely, and benefits always come up,
Absolutely.
So with the high cost of medical coverage in mind, how can employers afford this dental coverage? I mean,
Yeah.
realistically.
Yeah, that's a great question. So, we all know that medical costs are, through the roof and continue to rise. So for employers that don't have, extra money for ancillary benefits in their budget because they're spending it all on the medical premiums, they can look into voluntary programs. And what is meant by voluntary is those are plans where the employer is not required to have a minimum contribution amount. So it's a different contribution strategy. A voluntary plan will allow the employer to offer a group benefit and pass on some, most, or all of the premium to the employees. And the great part about that is you're giving an employer-sponsored benefit or group benefits to your employees, which are typically less expensive and more robust, rather than having them go seek out benefits on their own, which they may not be likely to do. And then the plans are not as rich and the costs may be higher. So voluntary plan would be my recommendation.
Okay, fantastic. So a few things had come in during the presentation. One of them was Sarah had said, I was intrigued when you said that dentists can identify early symptoms of diabetes. My dentist has never mentioned this to me. What questions should I be asking my dentist to make sure he isn't seeing symptoms and not saying anything? Yeah, I would think what are to be a proactive patient, I guess.
Yeah, so not as the clinical expert here, I will ask my colleague Keith LeBeau, our Chief Clinical Officer at Delta Dental of New Jersey, if he would help and answer that question.
Hey, thank you for that. And that is a great question. Excuse me. Probably the top clinical question you would want to ask your dentist is, do you have any signs of periodontal disease? Do you have any signs of gum disease? Because we know that there is such a strong bidirectional relationship between gum disease, which is an inflammatory disease, and diabetes. That would be one of the top questions you'd want to ask. And ideally, dentists would like to address periodontal disease at the earliest possible stages, because that's when it's most highly treatable and can get the best possible results. So that's one question. The other question would be, do you have any other risk factors for type 2 diabetes? And I'm not going to go into all of them, but there are a number of very well-known risk factors for diabetes. And it's important that dentists understand your history. So, for example, family history. Family history is probably the number one determining factor for being at risk for diabetes. Uh, ethnicity could be a risk factor as well. Hypertension, high blood pressure could be a risk factor for diabetes. So there are any number of risk factors that are well known to dentists and the overall healthcare profession that the dentist should be evaluating for as part of a routine exam. And it's also one of the reasons why it's so important for them to take that comprehensive medical history and keep it updated whenever you come in, and also make sure they are taking your blood pressure, because again, hypertension could be a significant risk factor for diabetes.
Oh, thank you. Dr. LeBeau, while you're here, there's another question about, you mentioned the loss of tooth enamel for eating disorders. If someone is in recovery for an eating disorder, what can they do to prevent cavities and restore tooth enamel?
Yeah, I mean, this is a complex question, and clearly one of the first things that needs to be addressed is the eating disorder itself, because addressing it while the eating disorder is continuing could certainly limit the chances of successful treatment. But that said, assuming that somebody is undergoing effective treatment for the eating disorders, and if they've lost enamel, fluoride treatments, even for adults, can be effective at helping to prevent decay. And there are techniques to restore enamel, particularly when you've lost significant amounts of enamel, and you have the underlying dentin, which is much softer, much more prone to decay exposed. Getting crowns, people call them caps, but crowns is a full coverage restoration, usually made out of an all ceramic material, sometimes with some metal in it, and it protects the tooth and can protect the tooth from having decay, further decay or fracturing or breaking further.
Thank you so much.
Welcome.
There's other questions that are coming in, Dr. LeBeau. I'm not sure if it's for you or it's for Karen. And it says, with better awareness of the importance of mental health, it appears there is more engagement with getting dental care that can hopefully minimize costs by preventing treatment versus maintenance. And this looks like an insurance, but will that result in dental insurance rates going down over time? This is right, Karen.
I want to ask so I understand it. Will the preventive care, the increase in preventive care result in a reduction in dental rates?
That's what it reads. Yeah, I think so.
Summarizing. Okay, great. Yeah, well, I would hope that would be the case, right? If we're seeing less of the, what we call basic and major services, which are really, when you have a problem, if everybody has a healthy mouth, I would suspect that would be the trend. And that's why we encourage, right? That's our vision and our mission at Delta Dental. So we encourage preventive, and that's why we don't limit people to every 6 months. It's 2 visits a year. So get the 2 visits. So yes, I would say yes, that would be the trend if we move in that direction.
Right. Excellent. I would think so. And then one last question, does Delta Dental have any community programs that support or educate the mental and oral health connection?
That's a good question. We do have a foundation. I don't know, Keith, if you have anything to
I would. And what I'd say is the Delta Dental Foundation is, focusing on community efforts, and it's very focused on communities that are subject to potential higher oral risk of decay and under treatment due to social determinants, that they may be experiencing. Our 3 main areas that we've always focused on have been children, seniors, and veterans. And we have any number of outreach programs and grants that support those initiatives. We've been involved in the public health area, working with FQHCs, for example, with Zoo Fall Health in New Jersey, with a number of communities in terms of funding their mobile dental unit, which is able to get out to very remote areas to provide care to individuals who might otherwise not have access to prevent future problems. And their new facility, we were very involved in supporting their new dental clinic at their new West Orange facility, as well as other initiatives. So we are very involved in reaching out an engagement to help these at-risk communities.
Thank you, Dr. Lolo. That's fantastic. So it looks like we don't have any more questions unless some are peppering in. We'll give you a couple minutes. I just want to thank everybody again for popping on and reminding everyone that you are going to receive an email with the recording of this presentation. Karen, this presentation was super informative. Thank you so much. Did you have any last words?
No, I just want to thank you for having us. It's been
wonderful.
a pleasure.
Well, thank you for coming on. I mean, it's something I feel like everybody's afraid to go to the dentist, but it's, you have to go. And it really is not like, I feel like, lately they just make every move to make you feel comfortable, right? And you just get it done.
And you feel so much better after you go.
You always feel so much better after you go. Absolutely. So, all right. Well, thank you, everybody. I want to remind everybody about the recording. Also, this Friday, a little NJBIA plug, we are offering a complimentary workshop in conjunctions with Rutgers Camden School of Business, Unlocking AI for Social Impact. This is a free workshop from 9 to 11 at Cooper's Riverview in Trenton. There. Thanking everybody. And thank you, Karen, and reminding everyone to 6 months, get your teeth cleaned and checked out. Take care, everybody.
Bye-bye.